Good day, all. I welcome you to study session 8 of NSA 307, which we discuss diet therapy. We have discussed in the previous study sessions, we have discussed about macronutrients, the protein, the carbohydrates, their importance, and the excesses and the imbalances. Now we want to discuss about diet therapy. Please sit down and enjoy this lecture. At the end of the study session, we'll be able to describe therapeutic diet and its purpose. We'll be able to discuss the various types of therapeutic diets. We'll be able to explain the basic principles of diet therapy. Let's look at diet therapy. The term diet therapy refers to the usage of food and nutrition in controlling symptoms and creating the best possible life for oneself through health and wellness. Therapeutic diets are special diets that is designed for people with certain medical conditions. A therapeutic diet is used to help a medical condition from a nutritional perspective. Changes in diet can help or even relieve some medical conditions. Some illnesses can be effectively managed by altering your diet, and diet therapy is sometimes used before surgery to ensure that surgery is absolutely necessary. A therapeutic diet is a meal plan that controls the intake of certain foods or nutrients. It is part of the treatment of a medical condition and are normally prescribed by a physician and planned by a dietitian. Therapeutic diets do not replace the treatment provided through medication or other treatment, but rather should be used in conjunction with a medical treatment. Always be sure to check with a physician and follow his prescribed medical treatment. Additionally, be sure to discuss any diet and lifestyle changes with your physician. Looking at the purposes of diet therapy, many health conditions are caused in part by what you eat. As such, treating or preventing these conditions may involve a change in diet or a special diet, often called a therapeutic diet. With a therapeutic diet, you add or limit certain foods to improve a specific health condition, and some of these conditions that can benefit from a therapeutic diet include cardiovascular diseases such as coronary artery diseases, hypertension, heart attacks, and stroke. Diabetics can also benefit from a therapeutic diet, as well as people with gastrointestinal diseases such as Crohn's disease, ulcerative colitis, and celiac diseases. People with food allergies can also benefit from therapeutic diets. A therapeutic diet looks different depending on the disease or condition a person has or is trying to treat with their diet. Most of the time, as a general rule of thumb, therapeutic diets are high in fresh fruits, vegetables, whole grains, and dairy products, and are lower in fat, sugar, and processed foods. Let's look at the common reasons therapeutic diets may be ordered: to maintain nutritional status, to restore nutritional status, to correct nutritional status, to decrease calories for weight control, to provide extra calories for weight gain, to balance amount of carbohydrates, fat, and protein for control of diabetes, to provide a greater amount of a nutrient such as protein, to decrease the amount of a nutrient such as sodium, to exclude foods due to allergies or food intolerance, to provide texture modifications due to problems with chewing or swallowing. What are the types of therapeutic diet? A therapeutic diet is usually a modification of a regular diet. It is modified or tailored to fit nutritional needs of a particular person. Therapeutic diets are modified for nutrients, texture, or food allergies and food intolerance. For nutrient modifications, we can have no concentrated sweet or diet. It can be for diabetic diet. There should be no added salt diet. It can be low sodium diet. It can be low fat diet. It can be high fiber diet. It can be renal diet. Also in texture modification, we can have mechanical soft diet. We can have puri diet. In food allergy or food intolerance modification, we can have food allergy. We can have food intolerance. And in tube feedings, we can have liquid tube feedings in place of meals. We can have liquid tube feedings in addition to meals. We can have additional feedings. Also, let's look at the basic principles of diet therapy. If your doctor has suggested diet therapy as a means for wellness, consider the basic principles of diet therapy so you know what questions to ask and what to expect. When you are suffering from an illness brought on by poor diet, Your doctor may suggest diet therapy before considering other medical treatment, prescribing drugs or surgery. Certain conditions such as heart disease can be managed more effectively when diet is under control. As the American Heart Association points out, a healthy diet is one of the best ways to reduce heart problems and to live a healthier lifestyle. Your doctor may even suggest diet therapy simply because he notices you have precursors or red flags for heart diseases, even if you are not currently diagnosed. We can have a system modification too. When you indulge in unhealthy eating habits like choosing fatty foods, eating too many sweets, or avoiding vegetables, you put yourself at a risk for serious health problems. After assessing your diet and risk, your doctor may suggest a modified diet to help prevent further problems from occurring. It's important that if you receive this type of advice from your doctor, you follow through as you would by prescription medication. Changes to your diet can take place in small and simple ways, yet add up to make a big difference to your health. The diet therapy can also be for organ rest. When you're about to undergo a surgery or your doctor is looking to isolate health problems, you may be asked to use diet therapy to offer a clearer picture of your health challenges or to help the surgery go more smoothly. Some doctors will instruct you to go on an all liquid diet or soft diet, which can help give ailing organs a chance to rest in the digestive system. While diet therapy is helpful for gastrointestinal disorders, it can also be used to build up to a normal diet once again. Thank you for listening. See you in the next slide. Bye for now.